All right, let's dive into a medical case that's basically a high-stakes plumbing problem happening inside the human body. We're talking about a clog in the system, but one with potentially devastating consequences.
So think about this for a second. What happens when a dam blocks a river? Well, the water stops flowing, right? And all that pressure builds up and up behind the wall, putting the whole upstream ecosystem under a ton of stress. This is the perfect way to think about what we're talking about today. Just keep that image locked in your mind.
And that brings us to the official term for it, obstructive uropathy. It's that dam in the river, except the river is your urinary tract. And that dangerous backup of pressure, well, it's threatening your kidneys. And that's exactly what makes this whole thing so serious.
Okay, so how does a doctor even start to figure this out? It's kind of like a detective story, really. This first phase is all about gathering those initial clues to figure out where the blockage is and what's causing it.
So the investigation kicks off with a whole range of potential clues. It could be something obvious like lower urinary tract symptoms or suddenly not being able to urinate at all. Maybe it's a sharp pain in the side. But sometimes it's way more subtle, like an unexplained number on a blood test, the serum creatinine. See, that's a key waste product that healthy kidneys are supposed to filter out. So when that number starts creeping up, it's a huge red flag that the system just isn't working like it should.
Now here's what's so tricky about this, and it's an absolutely crucial point. The absence of pain doesn't mean everything's okay. In fact, some of the most dangerous blockages can be totally silent. Why? Well, think about it. A slow, chronic obstruction might not cause that sharp, acute pain, but that constant, low-level backup of pressure is quietly doing gradual and sometimes irreversible damage to the kidneys. So you just can't rely on pain to judge how serious this is.
So once the the doctor, has collected all the clues, the next step is to localize the problem. Is this happening high up in the system, or is it low down? This is where they start sorting the evidence. If the main symptoms are things like trouble urinating and you can feel the bladder is distended, you start thinking it's a lower tract problem. But if the big clue is that sharp flank pain, then you start looking higher up, thinking about things like kidney stones.
Okay, now let's raise the stakes, because not all of these blockages are created equal. Some of them are a true, time-sensitive emergency where every single minute counts.
And this is exactly where the situation can go from just a serious problem to a full-blown, life-threatening crisis that demands immediate, decisive action.
So what are these major red flags? Well, if you have a blockage plus a fever, that screams trapped infection, which is incredibly dangerous. What if the patient only has one kidney? There's no backup system. If both sides are blocked, or if urine output stops completely, what we call inuria, that means kidney function is basically teetering on a cliff's edge. These are the alarm bells that tell a doctor they have to act now.
And this quote from our source material really just says it all. When those red flags are flying, the top priority isn't running more tests to get a perfect diagnosis. No. The priority is getting that pressure off the kidneys. You decompress first, and you figure out the rest of the details later.
All right, so we've identified that it's an emergency. Now we move to the action phase of our story. How do doctors actually go about relieving that dangerous pressure?
Well, to intervene the right way, you first need a clear picture of what's going on. And choosing the right imaging tool isn't a guess. It's a calculated, logical decision. If a kidney stone is the prime suspect, a non-contrast CT is the go-to. But if it seems more like a lower tract issue, an ultrasound is going to be your best bet. It's all about tailoring the tool to answer a very specific question, fast.
And this all boils down to the core strategy of intervention, which is actually beautifully simple. Decompress first, treat later. Step 1 is just about getting that pressure off the kidneys, right now. You use whatever tool is going to work, a catheter, a stent, maybe a nephrostomy tube. Then, step 2, actually treating the root cause of the blockage. That can wait until the patient is stable and the immediate danger is over.
So the pressure's been relieved. Case closed, right? Well, not so fast. The case isn't over yet. Now comes this really critical post-intervention phase, the road to recovery.
This is a period of really watchful waiting. The clinical team is tracking urine output, making sure that flow is restored. They're keeping a close eye on that serum creatinine level, hoping to see it start to fall, which confirms the kidneys are starting to recover. And they're also on the lookout for a potential complication called post-obstructive diuresis. That's where the kidneys, now that they're unblocked, can kind of overcorrect for a bit and produce huge amounts of urine.
So after walking through this whole process, what have we really learned? Let's take this medical case and distill it down into a blueprint. A set of lessons that can be applied every single time. Any good blueprint is built from learning from past mistakes. And here are some of the most common diagnostic traps. For instance, just assuming lower tract symptoms in an older man are always just BPH or an enlarged prostate. Or underestimating a blockage just because it doesn't hurt. Avoiding these pitfalls is what separates a good outcome from a bad one.
And that brings us to the blueprint itself. It's a really simple 4-step framework that guides the entire process. Step 1, recognize the clues. Step 2, localize the problem. Step 3, prioritize and figure out if it's an emergency. And Step 4, decompress to save the kidney. Recognize, localize, prioritize, decompress. It's a system.
And that's really the ultimate takeaway here. This isn't about trying to memorize 100 different causes of obstruction, it's about having a structured, reliable framework for your thinking. This kind of systematic reasoning is what reduces errors, improves diagnostic accuracy, and, at the end of the day, it's what saves lives.
So it kind of makes you wonder, doesn't it? This clear 4-step blueprint is incredibly effective at solving a really complex medical problem. What other complicated problems, in business, in engineering, maybe even in our own daily lives, could be solved more effectively if we just had a similar, systematic approach?